the United States has pulled back from a lot of its investments in those areas. Now with the crisis with Ebola, we see that the challenges that have been brought about as a result of our surveillance, early detection, and the like. So I'm just very concerned about what the administration's strategy is, because we're clearly seeing here that what goes on the continent of Africa directly affects our public health as well.
Well, first of all, I don't agree with that assessment. I mean, first of all, it's not about cutting back. The response here is not just how much money you spend, it's what results you're going to get. Now, let's talk about Ebola for a second. Ebola, the outbreak in Ebola was in a war-torn, isolated, rural area in the DRC. That's where that began. Since that time, our response has been very quick, very rapid.
Well, so you're saying you did not cut early detection, Piers. I'm not talking
I'm saying that whatever you're pointing to as the cut is not the reason why there was an Ebola outbreak.
I'm not connecting the two. I'm simply saying.
Well, you are connecting them. You said that our cuts...
Senator Rubio, I'm not trying to get in an argument with you. I would really like to actually have my questions answered. So very quickly, we cut early detection when it comes to infectious diseases on the continent. Factually, this is not an opinion. We made those cuts. We cut early warning systems on the continent.
It had nothing to do with the Ebola outbreak.
So I don't need to tell you, Secretary Rubio, that we're living in a place where an infectious disease crisis anywhere is a threat to public health everywhere. The United States has made major reductions in these areas that have put us more at risk. If you're talking about this clearly Ebola crisis, there's other things and other cuts we've made, and you see it factually. Even our own State Department personnel that I've talked to are saying we're less prepared for a global outbreak than we were before. And my worry is, specifically in a budget hearing, is this budget makes even deeper cuts into the kind of things that could prevent the next outbreak, or, as we've seen unfortunately with COVID, have us more prepared.
Yeah, I don't agree with that assessment. I don't know who told you that at the State Department.
So just let's move on. My time is limited.
I know, but that's an important question. I don't want to eat up your time, but I need to answer that because I just don't agree with that.
Mr. Secretary, you can't even agree on the facts.
Because that's not accurate. I mean, again, you look at what we've entered into with these
It's not accurate that we cut early detection.
Because those have all been repurposed in different arrangements that we now have with these countries. As an example,
I would like, for the record, because we're not going to cover it in my short time, if you're telling me we are as prepared or more prepared before the Trump administration came in, I'd like to see the facts.
I think when these reforms are finalized, which we're on the verge of doing, we're actually going to be better prepared.